think it moves around based on what.
Okay, so I'm here, or not here, virtually with Betsy Ladyzhets, who's a reporter, and Betsy, I'll just let you introduce yourself and your credentials, which I think sort of have, or anyway, you can introduce yourself at the moment.
Yeah, sure. Yeah, it has been a bit fluid, I guess. So I'm Betsy. I'm a freelance science and health and data journalist. Been working for a lot of different publications, and recently I was a fellow at an outlet called MuckRock, which is a nonprofit that does public records-based reporting and also kind of helps people file public records requests and does other work kind of in that space. And they do a bunch of data journalism and investigative journalism.
And
And
so,
so as a fellow,
yeah, so actually, so one of the things I wanted, I actually, that's really helpful. Thank you. So I wanted to have Betsy on to talk about her reporting on long COVID and the NIH initiative. And so I think you were just going to talk about, you started working on that project, or was that what you were going to talk about? Yeah, so why don't you tell us how you
yeah.
started working on that?
Yeah, so I've been interested in Recover for a long time. I obviously read the news about it when it was first announced in December of 2020, because I had been covering COVID at that point since, early in the pandemic, and I started to follow kind of the official announcements about it. But then
And
maybe
again,
around a year,
the announcement that there was going to be 1.2 billion
yes,
or less to be
yeah.
spent on long COVID in some way or other.
Yeah, and I remember at that time it seemed very exciting. Like I remember seeing the excitement from the kind of advocacy community and from patients and scientists saying, like, this is great, this is what we need, big investment. But then I think it became clear, sort of as time started to pass, that the investment maybe wasn't being allocated or spent in the right ways. And I remember I think it was fall of 2021, I learned about a letter from the Patient Led Research Collaborative and some other groups that was being sent to the NIH to express some concerns that they had with like the early setup of the program. So
Hmm.
that was one of the kind of first things that got me interested. And I ended up writing an article as a freelancer for this site called Grid News in 2022 in the spring that went over some of the early concerns with issues like recruitment and the lack of expertise from folks who understood like ME/CFS or PODS, forms of dysautonomia, and the fact that they weren't being included in the program and some of the other kind of early concerns that people had at that time. So that was as a freelancer. And when I was working for MuckRock doing COVID public health, kind of accountability focused investigative stories, I brought this to my editor and said, I did this one story last year, but I really feel like there's more to dig into. And he, and other MuckRock folks kind of advised me on filing some public records requests and starting to do a bit of other digging on this. And looking at some other long COVID topics as well. But I think Recover really rose to the forefront for us as, something that is both a huge chunk of money that kind of deserves attention and deserves accountability reporting just for its scale, and also could potentially have a lot of impact, either if it was done well or done poorly. Either way, it's
Well, I
a
think
huge program.
1.2 billion, it just the announcement of it got a lot of attention. So you sort of then
Yeah,
you assume sort of then after they announce money, it just sort of happens, and then things will be good after that because there's
yeah,
money. And if you don't track actually what happens, then you don't really know.
yeah, exactly.
So then
So I started working on it. Oh, you're
you
gonna,
up with, and then you hooked up with Stat and produced the
yes.
article that came out last month, which was what I actually contacted you about. Yeah. So how did that happen?
Yeah, so first there was the article this past spring that was a collaboration with Rachel Kors, who's a political reporter at Stat and also had done some of her own reporting on Recover. And you've written about that piece. I think folks are probably familiar with that. And then kind of continuing to follow the trail, we were very interested in the clinical trials announcement that happened at the end of July. And I think a lot of the news about that, similar to what you were just saying with the news about the first funding, was a lot of people just saying, oh, this is great. It's been announced. They're finally starting clinical trials. Yay. And I, as someone who's trying to pay attention to the responses that folks had to this, I sort of saw like it's a little bit more complicated. People are pretty unhappy with the choices they're making on these clinical trials. And the clinical trials themselves had been a focus of the investigation in the spring as well. So I wanted to kind of follow up on it. And luckily, I think it was sort of serendipitous in that MuckRock had some funding to pay me as a freelancer for the story. Stat was interested in running it as a follow-up too. So we were able to just kind of get it going pretty quickly. Yeah, I should clarify, I'm no longer like officially a fellow at MuckRock, but this piece happened as sort of a
So,
freelance
so,
basis.
let's talk
Got that
about
way.
what it was that you found. I mean, what were the main concerns that you found, and basically also explain. It's a lot of money, and as you explained, there was sort of observational research going on to try to understand the disease, so-called, long COVID or what it was, and then there's the whole
Yeah,
part about clinical trials, which for the most part is probably what interests patients the most because they just want to get treatments. I mean, the science is great,
exactly.
but they don't care so much about the science as only insofar as it leads to treatments that make them better or make them, prevent it from happening in the first place.
Yeah, so I would say there are a couple of big things that stuck out to me. One is a concern that they're not testing the right treatments, primarily, especially not testing enough pharmaceutical treatments or drugs, whatever you want to call them. The recover studies that they've planned include 5 kind of arms of clinical trials. And out of those, there's only a handful of actual pharmaceutical treatments that are going to be tried. One of those is Paxlovid, and then there are 2 we know about that are going to be part of the autonomic nervous system trial.
Mhm.
The Paxlovid one has just started. The autonomic nervous system one is on deck for the next couple of months, I believe.
So basically, and that they divided the symptoms up into they divided 5 categories of
5
symptoms.
categories, yeah.
And so within those, they're doing some trials. And so you mentioned the autonomic dysfunction category, which would be things, orthostatic intolerance and POTS and
Mhm.
that kind of thing. And so the other categories among them are.
Yeah, so the Paxlovid trial is meant to be testing like viral persistence, which is, I would say, more of a hypothesis about how long COVID happens than a kind of category of symptoms. The other ones, there's a cognitive symptom focused trial, a sleep focused trial, like sleep disruption, and then the exercise or fatigue trial,
Right.
which is,
Another.
that whole thing could be the topic of a different
Right.
interview.
Right.
Yeah.
So let's so first you talked about there weren't enough, the other ones, there aren't enough compounds because as we know there are a lot of compounds that have been used for
Yeah.
MECFS for similar symptoms and that could be tested on a large scale here and that people have been frustrated have not been the subject of large scale trials.
Yeah. Yeah, so that's a big part of the frustration. Like there's this whole list of drugs from NECFS, from dysautonomia, from other similar conditions that they could be trying. And that in some cases would be really hard to test without the scope or the kind of support of a government trial. One example I think that we talked about in the spring story is metformin, which is a drug for diabetes that in one paper recently showed some promise in maybe preventing long COVID. And there's an interest in maybe trying it as a treatment, but because it's this generic drug that doesn't have maybe interest from a pharmaceutical company to try it themselves, it would have to be, or at least, it would maybe be very hard to envision like a large scale clinical trial outside the scope of something like Recover. So it seems, a lot of kind of folks who I talked to about this were saying it seems like kind of a wasted opportunity to have this big list and just be picking out a handful of things.
Right. And the other thing, so and going to the exercise trial, of course, this gets into the whole issue of post-exertional malaise. And are they even sort
Yeah.
of considering it? And why would you do an exercise trial without having very, very clear ways of screening out people who have post-exertional malaise who you would automatically assume would not be appropriate for that trial? They don't seem to have thought of that or know how to do that.
Yeah, I mean, I think that goes to another one of the big picture issues that I found, which is even for the trials that maybe would include more promising treatments, they might not be structured or set up in the right way. Like many people with long COVID have post-exertional malaise, so that's obviously something that needs to be taken into consideration, not just for an exercise trial, but also for kind of the other trials.
Mhm.
This is something that I've talked to Todd Davenport, who's an expert in physical rehabilitation for ME and long COVID about a couple of times. And he sort of explains it as like, this is such a prominent symptom for people that it should be tested as an outcome or as a potential adverse measure for potential adverse effect for any kind of treatment.
Right.
And, the way in which these trials are being designed, there are, this is just one example, I think, of concerns that I've heard about in, how the studies are structured. What are the measurements that they're looking at? What are the outcomes? How are they, collecting information from the people who are going to be trying out these different treatments?
So
Is it going to show an effectiveness, or yeah?
there was pushback on that the exercise arm. So what's
Yeah.
happened with that? It's still sort of in a state of flux, as I understand it. I mean, they sort of said, no, we're
Yeah.
doing it correctly. And then they said, well, okay, we'll talk to you. And then they said, okay, well, we're going to do some revisions, but nobody really knows quite what they're doing yet. Is that sort of the way it
Yeah,
is?
that's kind of my understanding. I asked them about it most recently for this story that came out a couple weeks ago, and the answer was similarly like, yeah, it's in the process of revision right now. They didn't say very much about what that revision looks like, although they did give sort of a timeline that they expect to launch it by the end of 2020.
And as you said, nobody's actually, or maybe it's changed since we wrote the story, but nobody's been recruited for any of the trials yet. And we're already 2.5 years, I guess, after the money was sort of allocated. Or is it that long? Wait, we're already a couple, a ways into this.
Yeah, December 2020. Yeah, 2.5 years, I think, is
2.5 years.
fair.
And so
Yeah.
nobody's recruited in any trials yet, as of a couple of weeks ago,
Yeah.
as of a few weeks
Yeah,
ago.
the recruiting is like open officially for the viral persistence or Paxlovid
Okay.
study.
Okay.
But
To be
I
recruited.
think it's a little unclear. I mean, I guess I should say they haven't shared any like numbers of people recruited yet or anything.
So, so the other part of the study, when more of the money is going to sort of, I guess, the overview of symptoms or can you just describe that briefly and what they're doing?
Yeah, so I would say this is another thing that people just have been frustrated about with Recover for a while now, which is the kind of allocation of funding to the different arms of the study. So the really big one is the observational research, I think is what folks generally call it, or like attempting to measure symptoms over time. So Recover and all of its different academic partners that are running these trial sites across the country have recruited thousands of people with long COVID, and then also a smaller number of people who either don't have long COVID or who, recently had acute COVID to follow them over time and see what kind of long-term symptoms they develop,
Occasionally,
and are doing all these different medical
occasionally
tests.
your sound is fading away when you sort of move. I'm not sure what that's
Oh
about.
yeah.
Okay.
Sorry, my computer microphone isn't the best. I probably have to be a little closer. Is this
Okay.
better?
That's better. Yeah.
Yeah. Um, yeah, so they're recruiting all these people to kind of study their symptoms over time through both surveys and different medical tests. And that includes mostly people who have long COVID, but also smaller groups of folks who either have never had COVID or who have not had, have no evidence of a positive test, at least, which we know is not actually never had COVID in some cases. And then also people who are recruited at the time that they get sick with COVID to kind of follow over time and see what symptoms they develop. And, I think there's this quote in the story, I think from David Petrino, that sort of indicates that the observational trial is a waste of money. And I remember that got shared a lot on social media. And so I think it's important to clarify that I think the argument is not necessarily like any kind of observational research for long COVID is a waste of money, but more so that when you compare the scale of this part of the study, when you compare the scale of, all of the funds spent on doing different types of medical testing and the records that they're keeping and the long-term follow-up and the consultants involved, et cetera, that compared to the money spent on clinical trials seems like kind of a mismatch.
What
And
and
folks
the
would really like there to be more on the clinical trials.
what is the mismatch? How much is the money?
Yeah, well, I pulled up the story, so I'll give you the actual numbers. So the observational study is 47% of the budget. Clinical trials is 15% of the budget.
If that's
And
40% of
then
1.2 billion.
47% of 1.2
Wow, okay,
billion.
that's a lot.
Yeah. Yeah. And then you have other sort of smaller chunks that are also, in fact, related to the observational study. For example, tracking the patient cohort over the long term is 11%. And then there's also like research management services administrative, coordinating. These are kind of smaller areas that make up about 5% together. So there's a lot of things going on that are not clinical trials. And there's this sort of concern that the clinical trials, also, or not, there's a concern that the observational study, for all of its size and scope, so far has yet to produce any kind of novel findings. There was the one paper out in JAMA a couple of months ago that came from the observational study, but according to the experts I've talked to about this, it wasn't really producing like really novel insight about long COVID. In fact, some people are very unhappy with it. Some people want it to be retracted. So
the people, that was basically the one where they said we did all these standard tests and everybody was fine on them, and so we don't really know what's going on, which basically is what people have been saying about MECFS for a long time.
Yeah, they were like, we have found these, I forget how many, but it was like we found 12 symptoms. I think it was 12 symptoms. They say we found 12 symptoms that we're going to use to characterize long COVID.
And they rated with the different weights.
They rated people, yeah. Yeah, and so you can get like a score of how likely it is you have long COVID. And I think there's a lot of criticism of that scoring mechanism, like criticism of the way they pick these symptoms, and also of media coverage. I think I saw a lot of headlines that were like, these are the 12 symptoms of long COVID, NIH says. Right. And as a journalist who's been covering this, I found that a little frustrating because I was like, that's not actually first of all, that's not actually what the study says. They do acknowledge that there are many more symptoms.
Right.
And, just there's a lot of complexity here, I think, that can be challenging to get at if you're just doing like a short news story.
So basically, it all sounds like a bit of not very well organized or thought through problem. And the other thing that you found, I guess, was that there doesn't seem to be any overarching, or it's not clear who's overarchingly coordinating the whole thing. Is that? Yeah. It's hard to figure out who's doing what for how much and so on.
Yeah, that's another challenge for sure, because you have all of these different kind of administrative parties involved with Recover. Like you have the NIH itself, but then you also have these academic institutions that are in charge of different parts of the study. Like Duke is in charge of the clinical trials, NYU is in charge of the observational study, and there's a few others. And then you also have all of these different sites where the research is taking place. So like universities and medical centers across the country that are recruiting the people and doing the measurements. And my assumption is my understanding is that they're going to run the clinical trials in a similar way with like a consortium of academic sites, and are kind of in the process of announcing those or figuring out which sites are going to like how many people are going to be recruited at which place and etc. So it's very decentralized, basically.
One thing that I wasn't quite clear, and there was a talk about sort of whether they're running out of money or whether Recover is running out of money. Does that mean they have no more money to do new things, or they don't have the money to actually finish the clinical trials that they've set out to do?
So they have money to finish the clinical trials. Okay. They have basically everything has been allocated, is the kind of terminology that they've used in statement.
But you're breaking up
to sort of say like all the funding has been earmarked for some purpose.
Okay.
I'm sorry. Yeah, so like all of the funding has been earmarked for some purpose, and that's all sort of decided. Okay. So they, outside of these 5 clinical trials that they've announced, that's essentially it from Recover, unless they get more funding from Congress or some other kind of federal source.
Okay, so I think we've pretty much covered it, and we've sort of tried to do it within 20 minutes, which I think is a pretty good feat. So
yeah, it's very complicated.
Thank you. It's very complicated. For those of you who remain confused, I understand. I'm still, I'm going to put the link to the article and so on. But thanks very much, Betsy. And I am now going to.
Could I say one more thing?
Yes, please do.
I just wanted to make a note that I am continuing to report on this. Unclear yet, like what exactly the logistics of or timing of those stories will be, but I'm very invested in figuring out all that I can on Recover. So if you're watching this and you have some tips or stories to share, please reach out to me.
Okay, do you want me to, I'll add your email, or do you want to tell people how to?
Yeah, you can put my email.
Okay.
Yeah.
Okay, good. Thanks. I'm going to end the recording. Thanks.
Thank you.
Appreciate it.